So in the first session, we had a very good session on advanced EOS imaging, and Professor Julio Iglesias gave a very nice presentation and did also a case demonstration. And I would say that the key messages for this session are that advanced EOS imaging modalities, such as elastometry and detective flow imaging, may enhance the diagnostic yield of distinct pancreatic disorders. For example, mass-forming chronic pancreatitis, a mural nodule within a pancreatic cyst. And these advanced imaging modalities may also guide tissue sampling. After that session, we had a session on pancreaticobiliary stone management. So I would say that the key messages here were that in the absence of a distal biliary stricture, endoscopic papillary large balloon dilatation is a safe and effective procedure to facilitate extraction of large biliary stones. We had a nice case of a large biliary stone and trapped in the common bile duct, for which cholangioscopy-assisted lithotripsy was performed. And this cholangioscopy-assisted lithotripsy is highly effective and cost-efficient technique to extract such large pancreaticobiliary stones. Session 3, so this was, we had a lot of discussion during this session. It was on paradigm changes in the management of pancreaticobiliary disease, and we tackled several topics. The first topic was on distal malignant biliary strictures, and the key message of the session is that EOS-assisted biliary drainage is preferred over a percutaneous drainage in patients with a malignant distal biliary stricture and a failed ERCP. The second session was on the management of patients with pancreaticobiliary obstructive disease in patients with altered anatomy. And the key message is that depending on the clinical scenario and the available expertise, entero-ERCP, PTC, laparoscopy-assisted ERCP, and EOS-assisted biliopancreatic drainage are all valuable options to deal with pancreaticobiliary obstructive disease in patients with altered anatomy. The second part of the session on paradigm changes in the management of pancreaticobiliary disease was first dedicated to EOS-guided gallbladder drainage. The key message is that transduodenal EOS-guided drainage of the gallbladder with lumen-opposing metal stents is the preferred approach in patients with cholecystitis that are bad candidates for surgery. And in this session, we also have we had an interventional radiologist and also a surgeon, hepatobiliary surgeon, joining us for the discussion to have really an unbiased session. Then the last topic of the session on paradigm changes was on the EOS-guided radiofrequency ablation, and this was specifically for the pancreatic neuroendocrine tumors. And the key message is that EOS-guided RFA is a good alternative to surgery in patients with pancreatic insulinoma, but that its role in non-functional PNETs less than 2 centimeters remains. Then session 7, after the IBD sessions, was dedicated to EOS-assisted pancreaticobiliary drainage. The key message of that session was that the EOS-assisted pancreaticobiliary interventions can be used in case of a failed ERCP, so with normal access to the duodenum, or an impossible ERCP, standard ERCP, where you don't have normal access to the duodenum, for example, in patients with altered anatomy or in the presence of an impassable duodenal stenosis. And then the last session was dedicated to lumen-opposing metal stents. Dr. Sebastian Stefanovic presented the new consensus guidelines on safe use of lumen-opposing metal stents across the indications. This paper has just been accepted for publication in the American Journal of Gastroenterology, and I'm sure that it will help to decrease lumen-opposing metal stent-related adverse events. And in fact, the clinical case that we had was a nice example of troubleshooting during difficult lumen-opposing metal stent deployment while performing gallbladder drainage. So I would really like to thank the whole team for this very interesting day. And I'm looking forward to the next day tomorrow. This is the whole group. And so this is the program of tomorrow. So tomorrow we won't have ERCP sessions, but it will mainly be dedicated to endoluminal disease and colorectal disease. And at the end, we will have the hepatology session on bariatric endoscopy, where we will demonstrate again a gastrostomy procedure with lumen-opposing metal stents in a patient needing ERCP after gastric bypass surgery. Thank you very much, and I hope to see you all tomorrow. Thank you.